Welcome to the Veterans Impact Show, where our commitment is to help, hope, and healing of our veteran family and our nation. I'm Jim Blythe, a U.S. Navy veteran and a certified senior advisor. Join us as we continue the mission of leadership and commitment to our communities and our great country. Why, you never know where we're going to go or who you're going to meet. We invite you to join in, plug in, and share in what we do. This is your Veterans Impact Show.
Hey, great day. I am so fired up to be here. We're going to be talking about hope, health, and healing. And I got to tell you, this is going to be a great show. I want to introduce Cedric White to you again. He's my co-host. We've got to kind of change things to where we've got to get us all in that panel in the beginning.
That's right.
But he is a great minister and a great marriage counselor. I mean, really great. You work with the Department of Defense. You've worked with the VA.
Yes.
You've worked with marriage management. You help us veterans get our boots off and get our minds on to taking care of the family.
Taking care of the family, that's the biggest thing, right? Building better families by strengthening relationships. That's what we do.
You bet. And he's also my minister. I go a long way. We have a lot of fun at basically Healing Thine Heart's Ministry. Look us up. It is a fantastic opportunity to share the gospel, and I love being there. Now, I want to thank DBTV Network and AUN out in Northern California for carrying us on Amazon Fire and Roku, all of those wonderful, wonderful outlets for internet TV. We're on Saturdays at 11, and we're on Tuesday nights at 7. So join us on DBTV, join us on AUN. Also want to thank Fairway Independent Mortgage, the company I work for doing mortgage business. My MLS number is 311-548. That keeps the attorneys happy, okay? It's Symbiose Integrative Health. Amazing what they do. And through Symbiose Integrative Health, several years ago, I started learning more and more about healing and about helping. And I met probably 3 or 4 years ago, Dr. Kyle Knapp, an amazing chiropractor, doctor, who goes many steps further to making sure people are healed. So I'd like to introduce Dr. Kyle Knapp. Now, I got to tell you, he's an Army guy. He was a paratrooper. He jumped out of perfectly good airplanes.
Perfectly good plane.
Yeah. And every paratrooper I've ever known has got back problems. So he would know how to fix it. Right, Kyle?
That's absolutely right. It's, a lot of this stuff in my military service, I was actually medically retired for spine injuries of all things. And so I've dedicated my life's work in order to better understand my injuries to help not only myself, but also other veterans. And along the way, I found out there's some missing pieces. There's some hidden injuries that are being missed that leads to a whole lot of problems.
Well, let's talk about those hidden injuries, because there almost isn't any veteran that I've ever met who doesn't have some back issues, myself included.
Yes.
And we get them. I worked on the flight deck helping to load bombs. I carried big, heavy loads of cruise boxes off and on the ship. Other guy, you were a missile tech. Mm-hmm. All of us probably go in at 17, 18, 19 and do things we shouldn't have done, and they mess up our backs. And jumping out of perfectly good airplanes, Kyle, you really got it. So tell us about the hidden injuries. Tell us about why so many of us are hurting.
So I'll get to the point. It's actually what the American Medical Association calls alterations of motion segment integrity. Because most of the time there's also a few misinformations that's out there. Because Jim, you probably heard that you've had a slip disc, or you've heard, I know Cedric, you probably heard that along the way also. You guys ever heard about a slip disc before?
Mm-hmm.
Yes.
Yeah, so what if I was to tell you there's no such thing as a slip disc? I mean, there's herniations, and there's different types of herniations, but it's actually the bones that slip. And the reason the bones slip is because the connections between the bones, which are the spinal ligaments. And so these injuries, with the understanding of what the American Medical Association says and what we see, are the most commonly overlooked injuries that leads to long-term disability.
And so what you're saying is the ligaments who hold everything together, they're the guide wires that make it work, are not working properly.
That's correct. And with that, there's a lot of problems, because we all know there's different kinds of sprains. Anyone that's in the military or done sports or slipped, they know there's some that are different, and the spine has the same kind of ligaments, just a lot more, because it's ultimately protecting some really important structures like the spinal cord.
Okay, Jordan, would you please play that video of the spinal ligament injury so we can begin to see that?
Yeah, so you can really think of the spinal ligaments as like a heavy-duty tie-down strap that's sort of holding the cargo on a truck. And for military service, parachute landings, blast exposure, simply to carrying 100 pounds of gear can stretch and damage those straps. When they become loose, the spine becomes unstable. And really, the real problem is, standard x-rays and standard MRIs, is like they're trying to check the straps while the truck is parked and empty, and everything looks fine. This instability is the hidden injury that only becomes obvious when the truck is moving and under load. That's why we have to assess the spine while it's bearing weight and in motion to find that real problem.
Well, now that's,
as you saw.
Yeah, that's fascinating, Kyle. And you do in your chiropractic, and there's other chiropractors doing the same thing. You're using more of a motion study X-ray. Is that correct?
So it's let's back up on that. So I'm sort of a unique bird, so to speak. So ultimately, there's literally only two types of chiropractors that exist. Most of everybody is familiar with what's called functional chiropractic, which is excellent. I mean, it's excellent for managing symptoms and improving mobility. It's like a mechanic tuning up your engine to make it run smoother. Our approach, I'm what's known as a structural chiropractor. And a structural chiropractor is like a framed straightening shop, where we use objective evidence-based measurements from specialized weight-bearing x-rays to see if the frame itself is bent. And that's where we believe that underlying structural component, if it's corrected, does help to truly restore function and helps with leading to long-term relief.
Kyle, one of the things is I've had several friends, and especially when you get to be an old guy like me, and I'm real old, unfortunately.
No.
Hey, they tell me I've got to go in and have surgery because my spinal cord, the nerve core in my spinal column is being constricted, and therefore they're going to go take a roto-rooter and open up the canal. I'm going, that doesn't make a lot of sense to me. But then what do I know about medical stuff? Right? So is this alignment that you're talking about what creates this situation where you're pinching the spinal column itself?
Correct. And the thing is, as you were saying, we're veterans, most of us get hurt standing up, not laying down.
Right.
And so ultimately the big problem is the misunderstanding and awareness of these injuries, because standard x-rays that both are done in the medical sector and also typically in the Department of Defense or Department of War, they don't actually show these actual motion patterns. And it's not about just doing the study. There's a missing component, which is measuring.
So someone, for instance, you were a paratrooper. What about a guy who's flying jets off of a flight deck in the Navy? I mean, they practice crashing airplanes very effectively. And you pull a lot of G's inside of a fighter. I know, I've been there, done that as flight crew. So that also overflexes or changes?
Right.
Okay, what about being in a situation where you're in a special environment in the missile fire control?
Right. Well, we even had situations where just loading and offloading missiles while underway, which is where I know some guys who experienced some back injury that way, and they were later told, well, you have some degenerating disc in your back, right? But it came from that type of injury, and so they were given spinal taps and things like that, but to no avail.
Yeah, correct. That's the biggest thing we see, Kyle, and nobody gets well.
Right.
Yeah, and one of the problems is that the standard of care is one of them, and there's been a lot of changes in the healthcare arena also. But to answer your question, in order to degenerate the disc, you have to first damage the ligaments that protect the disc. And there's a series of ligaments that surround the actual disc. And so there is no such thing as slip discs, and there's no way to really herniate the disc without that abnormal force and motion. And so to go back to your question, Jim, yeah, with those serious G's, I mean, you're experiencing tremendous amount of shearing forces, that the body is quite simply not designed to handle. We're not designed to do a lot of the things we do on a routine basis. I mean, I love my car, but I can't run as fast as my car. I wish I could. Maybe I could have said that when I was younger, but your body is not equipped to move and to sustain a lot of those forces that are through there, and that's what leads to, the damage between the bones, and that will lead to what's known as osteoarthritis.
Okay, so
this is
most
a
of
test
the
that we
time,
find to identify that.
yeah, most of the time this is treated with narcotics, drugs, correct? Or you guys tell me, you had problems. How were yours treated,
Well,
Cedric?
hydrocodone, gabapentin, tramadol, anything that's pain related, I was given that to just, I guess, more or less mask the pain. But of course, when that wears off, then the pain is still there. So even told to get a special bed for my back, right? The sleep number bed, right, which is a great bed, but the pain is still there. Pain is still
Correct.
there.
And that's my experience also. Whenever I was medically discharged from the Army with a spine injury and other trauma sustained from service, they essentially assessed my spine by doing a laying down X-ray and then doing a laying down MRI.
Right.
And then they saw that not only there was fractures, but there was also severe herniations.
Right.
And then as soon as I got out of the military, they at that time when I got out, it was, we'll say a few years ago, they were definitely, that was what they used, and a lot of opioids, a lot of muscle relaxers, but yet they didn't tell me what was wrong other than I had fractures, because when I moved and bent, that's when it hurt. It didn't hurt really when I laid down. It hurt when I bend and moved. It's because when you bend and move, that causes specific bones to move.
Okay.
That aren't supposed to.
How do you then discover that? And then what do you do to help remedy that? Or can you treat it?
Well, that's a long, absolutely. Well, the first thing is early identification, because you can identify the problem, then there's no way to do that. The first thing we do in the location where we're at is we take specific types of x-rays, okay, which are called stress x-rays, which means that you move and bend like you saw in the earlier image of the neck where you move and then it causes that bone to slip, the vertebra slip. And then after we do that, we use a system that helps us to measure between every bone to let us know the location, the type, and the severity at the specific level in the spine about how bad the sprain is. And then we look to rule out, as I said, those AOMSI injuries, or as the American Medical Association calls, alterations of motion segment integrity, which are severe sprains that are worse than herniations. It's even worse than surgical stabilizations, according to the American Medical Association. And then, of course, once you have that assessed, then I use also a series of advanced techniques, by understanding the structure of the body. One is called Pettibon systems. The other one's called chiropractic biophysics, which is something that out of all the chiropractors, there's only literally 4 that are in the Dallas area that do what I do. And out of the whole profession of chiropractic itself, most of them, as I said earlier, are functional chiropractors, and that's 90%. So I make up the minority. And the interesting thing is, a lot of my other colleagues, they're prior military, and they came to the same conclusion I have when they went through school, because they don't teach us stuff in school.
So what you're saying is then the ligaments get stretched or get bent out of shape, and everything's out of shape. Mm-hmm. Okay. So you go in and you do these special x-rays with weight and structure, et cetera. Okay.
Correct.
All right. Let's come back to, what do you do then to help somebody overcome this?
So that's where it comes down to understanding the true structure of the body.
Okay.
And it's not as easy as like doing one thing, because everybody has different injuries at different places at different times. There's also typically there'll be different kinds of like structural issues. Like a real big one is like the legs, because one leg may be longer or shorter than the other, and you have to level the foundation first off, because the foundation's off, just like how with our homes, the foundation's off in our homes, like no matter how good everything is above, the foundation and the structure will damage everything above there. So that's one way is the first that we do is we want to make sure we have a level playing field. And then after that, then it's based off the area and our assessments and our objective measurements of which we provide the most robust assessments that is assisted, by artificial intelligence and machine learning. Because I used to do this in the day, and it would take me hours and hours and hours to come up with the data points that the systems and the diagnostics and X-rays do. And the only way to assess the bones is X-ray. And that's what's not being done is they're not testing where we get hurt. And that's ultimately one of the things that's also what I discovered, from experience with the Department of Defense. And I'm so Jim, I know Cedric, you can relate to this. If you remember, whenever you got out, they wrote down a list of areas of injuries and stuff you want to sick call for. And some may do a testing or not, and then they immediately, after you get out of there, they may assign a limited disability, and then they assign you out to discharge you, or either my experience is medical, others are just honorable, and then they immediately turn you over to the Veteran Affairs. And the thing that's really important to make a distinction with this, okay, we get injured in different, in the military and from sporting events, and in the military, they do not identify what are called injuries or impairments, okay? Impairment is a measurable way to determine the severity of an injury. And with the spine, if you have a certain amount of measurement in a certain way, that determines how severe that sprain is. And if that occurs, that will lead to a cascade effect and identify instability, except that's not being done, okay, for a few reasons, which we can talk about. But then, of course, we get to the outside in the VA, which we've all had, some of us had experience with the VA. I've had a deep relationship with the VA. I've existed in the VA. I'm a community care provider for the VA. They move into a disability.
All right.
The disability is a function loss from an injury, and they don't identify the injury.
Okay, let's continue this conversation when we get right back. We're going to take a break to hear from our partners, but also this is a fascinating conversation to me because I don't know a single veteran that doesn't, oh, golly, man, the back. And that is a problem because if your back hurts, you're not going to be able to take care of it. So I know what I do to help my back, and I know what Cedric does, but we're going to learn what Dr. Kyle does to actually fix the problem. So we'll be right back after these messages. This is Veterans Impact Show, your Veterans Impact Show.
Yes, sir.
Share us, join us, be a part of it, be a part of hope, health, and healing.
Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart's Ministry, and Symbios Integrative Health. Now, let's get back to this conversation.
Well, welcome back to the Veterans Impact Show. I'm Cedric White, co-host here with Big Jim Blythe. We have Dr. Kyle Knapp on today. Dr. Knapp is talking to us about a very serious area where a lot of veterans experience pain. A lot of veterans are dealing with the pain on a day-to-day basis and have been treated, but the treatment seems to be, I won't say subpar, but not fixing the problem. And so Dr. Kyle is explaining to us exactly what's going on, what's missing, and ultimately how we can get some relief from that pain. All right. So Doc, I want to ask you a question because the thing that's running in my mind is, okay, I'm loving what I'm hearing. Number one, that there may be some relief for some of the pain that I and other veterans are having. But the question that runs through my mind is, okay, going through the VA, how do I get them to allow me to come see somebody like you?
That's correct. So I am currently a VA community provider, except the current VA only allows treatments for what's called the functional chiropractic. So whenever I have veterans come in, I'll do the full assessment, we'll identify these impairments, and the current way the VA system is set up is that it only gives limited visits, and the equipment that is needed, because there's specialized type of equipment that's needed, is not in the current VA database. So it doesn't allow the correct, appropriate, correct, objective equipment in order to best suit and help the veteran. Because it's, and chiropractic is great. It's, as you said before, it's actually, many people are familiar with functional chiropractic. It's excellent for managing symptoms, but as I've got into it, I want to identify what causes the spine to change. And that's actually because of the connections, the ligaments that connect the bones in the spine.
Let's go ahead and play that lumbar degeneration. Can we do that, Jordan? Okay, there we go.
And so as we said, the ligaments connect the bone. The longer that the bones are disconnected, they slip when it goes, and it moves and it changes. And if it changes, it'll affect the gravity and the pressure that exists on the specific area. And then that will lead to degeneration and the structure to change. And so quite simply, what we use is we use an apples to apples approach, where once we identify the structure and verify that it is something that we can treat structurally, then quite simply, we reverse the time, because my goal is to get a younger, healthier, stronger spine, because we only got one of them. It has to last an entire lifetime, and the sooner we identify these injuries, the better it is, because the more there's degeneration, the more challenges it is to return those, because then the disc is off and then it starts to fuse and other aspects.
Let me ask you a question. What about genetic spinal curvature of the spine? What do you got, scoliosis?
Okay, so that's a great question. So there's actually, there's two main reasons that scoliosis occurs. Okay, one is, a most common one, based off the best information possible, is if there's a leg length issue. If there's a more than 6 millimeters of a leg length issue, that increases your chances of scoliosis. So that's a foundational issue. Okay, and so the other one is actually what's known as an upper cervical issue, which means that the skull that connects to the spine, because some kind of an injury, will cause a lot of the nerves that balance the spine to sort of be haywired. And what that'll do is it can cause curves that aren't really supposed to bend to the side. So we work with all types of curves. That's why our company is a Weird Spine a Curve. Is that we look to assess the position of the body, and then we look to change the structure of the body using the same method we use to assess. Which, to get back with what, you, Jim, and then Cedric was talking about, we use a combination of postural analysis, and then we use x-rays. And we use specialized x-rays that assess the way that we hurt. It's standing, gravity loading. And then once we assess that, we do specific kinds of movement or stress studies. And then the big missing piece that's not being done is we measure. Because if you don't, you can't see millimeters between different studies. You actually have to have a system that measures that. And then based on that level, I already know if there's a chance of herniation. And when it comes down to it, these injuries, this is why when you move and bend, it hurts. Because I don't know about you, I don't hurt as much when I lay down, but the testing is typically done laying down. And that's one of the big challenges we have, is that the way that they don't test the position of how you live. They don't test with, how you actually move and bend. It's all done laying down. That's why most all MRIs are laying down. In fact, in the Dallas Fort Worth area, there's only one MRI that's upright, and I like to use that one as well. One out of all the MRIs in the entire DFW area.
Well, Kyle, we've talked about military quite a bit, and all three of us are military. But also, the military and the veterans lead the way. How about people who had automobile accidents, who have had falling off of a ladder, or falling or hit by something? Kids playing football. Good grief. As a matter of fact, I don't know, you guys, I go way back. I remember a player named Hollywood Henderson, and there was a kickoff, and he was on the defensive team of the Cowboys, and he was going down the field like a 500-mile-an-hour freight train, and he hit this guy, and I mean to tell you, he knocked him flatter than a hit like that is just about like a military hit. So we do work with Symbios works with the NFL players. You work with the NFL Players Association. We see this not just in the military, but this is generic, and this can happen to anybody. True?
Let's be honest, you're absolutely right, Jim. This is a huge problem. And honestly, it leads to, what everybody calls arthritis, right? And there's actually two kinds of arthritis. One is caused from trauma, which is known as osteoarthritis, which is what we are identifying a precursor to, okay, by measuring. Because if you have an area that's moving excessively, it's too much, that's the area where degeneration, will occur with time.
Okay, can we talk about this when we come back, break from all of our partners? So this is a fascinating conversation, especially to anybody who's a pain in the backside.
Or has a pain in the back.
We
All
all
right,
dealt with it
guys.
one way or another. That's for
We
sure.
love being here. This is Veterans Impact Show. We're here for you. Cedric and I will be right back with Dr. Kyle Knapp talking about how you can get better and how you go connect with Dr. Kyle. And he said there are several chiropractors in Dallas who do this. It's all about knowledge and wisdom. We'll be right back.
Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart's Ministry, and Symbios Integrative Health. Now, let's get back to this conversation.
All right, Cedric White here, Veterans Impact Show. We are back with Dr. Kyle Knapp. Doctor, we interrupted you a moment ago when you were sharing information on arthritis. Can you continue telling us about that?
Yeah, so simply put, thank you very much, Cedric. Simply put, there's two types of arthritis. Okay, one is what's called inflammatory arthritis, which is like rheumatoid arthritis, ankylosing spondylitis, psoriatic, and there's quite a few others. Okay, over 100 different types, and those are also what's called the inflammatory. Then there's the other one, which is called non-inflammatory arthritis that's caused from trauma. And that's what we're identifying as the site of non-inflammatory arthritis. However, people with inflammatory arthritis will have these kind of injuries also. Because as Jim was saying on the earlier section, there's people that are in sporting events and injuries, and there's people that are in Little League that are having this from the amount of trauma, and I've done that myself. I used to do played hockey, rugby, and try to play everything I could to hurt myself because I didn't think I was destructible, when I was younger. But you get older, you get a little wiser. You realize some of the stuff we do, it changes us in little ways. And so one of the things that I'm very much a proponent of is early identification of these injuries using the method that we use. And as we mentioned before, there's quite a few chiropractors, functional chiropractors, and they're great. It's a great field. I've been licensed doing this about 20 years. I've been around it a little longer. My dad was a chiropractor. But it's a specialized niche of chiropractors that do what we do, and one of those groups is called chiropractic biophysics, which there's only 4, including myself, that do that. And then there's also, other systems, but it's very slow to adopt. And that's one of the things that is a challenge, and it's also injuries are sort of, go ahead.
Kyle, okay, what does it cost to do basically all of the assessment, and then what do the treatments cost? Because what you're telling me sounds like VA doesn't cover it, even other community care, or do they?
Well, they include X-rays, and we include all the complete reports that we have that will assign a impairment rating if discovered, which is a measurable determination, which is as evidence-based as you can get. And then it determines if they have insurance or not. We have a lot of other cash new patient plans that are, of course, if there's Medicare, there's different areas you have to be aware of. But typically, our goal is to help as many people as possible to identify where the site of why they hurt when they move or bend, and to change that non-surgically. And so we look at, first off, identifying, how their area is, and we have an army of different services, that are customized based on the patient, because we are not cookie cutter. We look to, we treat everybody uniquely because everybody's unique. They've had unique experiences, and oftentimes there's unique injuries. So we like to assess that as appropriate and treat as appropriate.
So, Dr. Kyle, what would you say to a guy who's been through several different iterations of treatment, had, spinal taps and so forth and so on? What would you tell a person like that And the fact that you say, okay, some people are dealing with the inflammatory arthritis as well as the type that we're talking about now. How would you begin working with that individual?
So an example, and that's a great question, Cedric. An example would be, I can give you one of the many different cases that we have, but one that I think is a powerful example is a medically retired Special Forces soldier that we had who came to us, and the VA had rated him at 100% for cervical and lumbar strain, which is different than a ligament injury. He was in constant pain. During our structural assessment, we identified that he had two critical issues that were missed. First off, he had severe sprains in multiple levels in his neck and his lower back. And the other one is he had a 14 millimeter change in one of his legs.
Oh,
and what that did was that actually led to one of the other reasons he was discharged was because of knee pain. And they didn't find out what the cause of knee pain was after multiple scopes. So they just put all this money into to a soldier. Of course, Special Forces is not an easy role to get to. A lot of schooling, a lot of money that the government spends, but they still didn't test and find the things that we discovered when he was discharged out of the military. And that's just one example. Other one is, I've had, as Jim was saying, I'm a preferred provider with the NFLPA's health insurance. So I've had multiple, former professional athletes that come to us, and we identify the injuries that they also are missing inside the actual NFLPA. And the NFLPA is supposed to look for what's called impairments,
Right.
which is what I said was called what the AMA calls the alteration of motion segment integrity, which are impairment injuries, which means these are severe sprains. And that, but based on that, so we have, once we determine the structure of the body, and if they are a candidate for structural care, then we look to make corrections, and then it's about to help them to do the things opposite of where their body and posture is. Because if you see the head going forward, you don't want to keep moving the head forward, you want to move it back. And if there's some kind of a bend going to the side through your mid back, you also want to make sure you're doing things that put, and use essentially tractions and other aspects. Really, it's really gentle, and then of course, a lot of the treatments, with the manipulation and the therapies is very much non-traditional treatments where we're looking to treat the structure and not just the joint, where we're looking to actually use it in the best method possible. And this is not something that was invented by me. I was fortunate enough to be around other veterans that actually were that discovered and brought the engineering approach to the body. And it's also important to know that, there's very few of us around in the Metroplex. And that's unfortunately the thing that's around the country is it's very, very few. And there's a lot of other information that's sort of been holding back. As I said earlier on, most people hear slip discs. There's no such thing. There's different herniations, there's different types, but there's no way to herniate the disc without damaging the ligaments between. The other thing that's been a problem is that the diagnostic codes from provider's point of view. It wasn't until 2016 that any doctor could identify individual vertebra. And so that's caused another challenge along the way is that those injuries weren't being assessed, and it's not a standard of care. And these injuries it's getting to pandemic levels. We test, we measure, but we find unfortunately more than we don't find.
Kyle and Cedric, a thought has come into my mind, and I'd like to run with it for a second, because this is September. This is Mental Health Suicide Prevention Month. This is a real important time that within the VA, within many of your VSOs, they're focusing on suicide prevention. Most of the time, and when I went through my treatments at Symbios, there was a lot of pain and as well as psychological things that were happening because of the treatment that we were getting that was really improving your life. So one of the things is when you eradicate the pain, you then give people clarity of thought, clarity to be able to understand what's going on. And also, isn't this, when you combine it, again, integrative health, like what Symbios does, that causes increased blood flow and oxygenation, you're talking about a total body healing situation where you can regain your mental health. You can regain your ability, and that's going to be suicide prevention. So one of the things we're talking about, everybody will gravitate and go, oh, I've got a pain in the back. No. What we're really talking about is total health in such a way that we are ending the mental health problems that create suicide, and we're ending the need for opioid narcotics.
Jim, what I hear you saying and what I hear Dr. Knapp expressing is, okay, there's an area of hope where there's been a period where, okay, it's just pain and or drugs. Either or, those were the options, right? And so now we're talking about something beyond that, because after a while, there are people who they get tired of just, I'm taking a drug, and if I don't take the drugs have this effect, and so I don't want to take the drug, but when I get off the drug, now I'm back to the pain. So it seems hopeless. And what we're here, right, to provide what? Help, hope, and healing, right? That's what we're talking about here with Dr. Knapp. That's what we're talking about.
That's it.
Absolutely.
Absolutely.
Yeah, and you're absolutely right, Jim, Cedric. One of the things that we also do is the education process, because most of the time they're not explained exactly where the injuries are.
Exactly.
About exactly where it is. Not just, oh, I hurt here, and you're absolutely right. Symbiosis, amazing technology, because that ultimately everything we feel, we perceive is all from nerves, and if there's different mental challenges and there's different types of stress patterns, that's going to affect the body in all different ways. That'll amplify the physical injuries. It'll be amplified because your body is like overwhelmed. And so having something like what Symbiosis does is a amazing technology that works best with what you'd call integrated care, because, there's always the chance that they can go to medications, and we're not against it. We often will co-manage with other providers. We also, if there's needed to be, there are certain cases that are surgical, so we like to be able to make sure that we refer them to the appropriate place, but not everything is a surgical and a pharmaceutical issue.
And Doc,
a lot of times
let me say,
it's the precursor that will lead to those things. You're absolutely right, John.
Let me say, I'm not anti pharmaceutical. I just, if there is an option aside from that, we often say, even from a mental health perspective, sometimes you need the medication in order to stabilize you so that you can get to a point of mental health and hear the things that needs to be heard. So the same thing here, right? The medication is good for getting you to a point, but if we can get beyond the medication, introducing outside pharmaceuticals into the body, that's definitely a better answer.
Absolutely. And it is a lot easier to treat a symptom than it is to treat the underlying problem. And that's one of the things we have to do is we have to try to find ways. And that's one of the challenges with what we go with, because everything's customized and there'll be specific things that we need help with, because not everything can be solved with the pill or going in to see your doctor.
Right.
There's also some little self-care and what we call spinal hygiene, which everyone's familiar with dental hygiene, brushing your teeth, hopefully flossing. There's specific things based on the structure of the core of the body of the spine that are needed to go that'll help to prevent further decay, if you will.
Well, Kyle, I went through some real bad back problems, and I had a rehab specialist that taught me a bunch of exercises, and I used those exercises, and that strengthens the core in your stomach, which kind of pulls and holds everything together. So if you don't exercise, if you don't eat properly, if you don't go and find out, you're doomed to basically pain that will grow and ultimately become debilitating. Correct?
Correct. Yeah, correct. It takes a little bit of work to stay healthy. It's not given to us in any other form other than the choices we make, in order to make those choices to do something a little different. Because certain things we go through and certain choices we make with our, we're led by a lot of the information that we receive either via TV or online, but it just takes a little bit of knowledge, so that's why we also look at adding those aspects in, once they get and they can move better, it makes it a lot easier to want to exercise. Once you get the core, as you said, the core area, once you know which levels in the body you need to specifically strengthen, Jen just then it also makes the process to help to move better, which in turns will help them do better. So we often see happy side effects, which is like you usually hear side effects as being a derogatory term. Happy side effects is like, improved sleep, improved energy, they reduce stress, several things that happen really when you start to see how the true structure of the body helps to relax. And that's one of the things that we look at as we provide a comprehensive approach, that's customized per the individual, because we're all different, we're all unique. So we like to approach it in that manner. So you're absolutely right, John.
Okay, Kyle, I got to interrupt you real quick because we need to give out your website. We need to give out your phone number where people can get in touch with you.
Yes.
And if there is, if you're in other parts of the nation, is there an association of the type of chiropractic medicine that you perform that people could go to this association and look up? I'm in Virginia Beach. I'm in Miami, Florida. I'm in Delaware. I'm in California. I'm in Colorado. Where can you go to find out about this? Please.
So that's a great question. So there's a couple different areas, but I'll post those links on our website. So once they go there, of course, if they're local, they can definitely come to where we're at, but they can come to us and then we'll provide those links of where they can actually go to look for others like us. Because this is something that is, the existing way that we're assessed needs to find a better way. So I will be posting those separate links that are on our site.
Okay, what is your website?
Go ahead.
What is your website?
Website is KURV, letter O, number 2.com. Yeah.
KURV, the letter
Yes, sir.
O, 2.
Yeah, we use oxygen. We work with the abnormal curves and we have oxygen therapies. And then, of course, our phone number, if you're in the Dallas area, is 972-488-4994.
Okay, say it again.
Website KURV, letter O, number 2.com. And phone number 972-488-4994.
So if somebody lives in Fort Worth, if somebody lives in Arlington, there are other chiropractors who do what you do that you could refer them to them as well, correct?
Yes, sir. Yes, sir. Yeah, I want to make sure they get referred if they're close, because this, if we can assess them here, we can assess them here. If not, I want to make sure I get them to the right place that's convenient for them in their area. But it's unfortunate, it's very few, that are like us.
Well,
because this is not done across the board.
There's, a number of years ago, there were very few doctors that did certain types of surgery and help, and now it's pretty common. I think it's important that we know and we learn, especially if you've got a family member who can't walk, who can't get up out of bed, who can't get up out of a chair. And you say, you got to work at this. You got to exercise. I can't. It hurts so bad. Why not go get the assessments? Right. If you're a veteran, the VA will pay for the x-rays. Is that correct, Kyle?
That is correct. Yeah,
okay.
We include all the deep reports as well.
And so then,
because how important it is.
Then quality of care can be put together, and there are ways to finance this. There are ways to get this done. So this is important. We're going to come right back to finish this up, bring this ship into the dock, because it's so important to have help, to have hope, and to have healing so that you can have a better today, a much better tomorrow. And I'm thinking of the commercial where the grandfather picks up the little girl to put the star on the tree. You want to be that man or that lady to take care of your child. This is Veterans Impact.
Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart's Ministry, and Symbios Integrative Health. Now, let's get back to this conversation.
I think we just fixed about 90% of the medical problems in this nation, Hallelujah. Praise the Lord. Pastor, we're going to fix them.
We're going to fix it. That's right.
Absolutely.
And Kyle, this is really, really important. Again, people are looking for a doctor that does it. There is a functional type chiropractor and there is a And you are a what kind? Say that again.
Structural.
Structural.
Yeah, structural chiropractor. Yeah. So just to, and as I said before, many are really familiar with the functional chiropractic. It's excellent, for managing symptoms. But we look at trying to change the structure, with the same method that we use to assess the body. So we compare apples to apples. But it's not as easy as taking a shot or taking a pill. There's a little bit of, assistance that's needed. It's not anything impossible. It just takes a little bit of some self-care, and that's one of the things we have to do to add that in to get these.
I wish I'd have known about this about 12 or 13 years ago. No, I've known about this 20 years ago because I had some problems that were so bad, and I took oxycodone, and that didn't do me any favors. There are so many medical things today and so much knowledge today that we have that sometimes even the medical profession doesn't want to share because it affects their bottom line. But go to people like Kyle, go to people like Symbiosis, go to integrative health doctors. And here's one of the big things in the VA. I had Dr. Benjamin Kligler on, who was head of integrative health in the VA and in Washington, D.C. You've got to look at the total integrative program. What does that mean? It may require some drugs to get you over the thing, may require some surgery, may require some chiropractic, may require some Symbiosis type help. It may require, it's multiple modalities, and correct me guys if I'm wrong,
You're right.
that'll bring you back to health. But you know what the most important thing, and you said it, Kyle, and you said it, and I've learned it, you got to take care of yourself. You can't just sit on the couch in the lazy boy with a big gulp and so, give me another pack of cigarettes, Mom. No, you got to take care of yourself or you are going to be in real bad shape. And I see it all the time, all the time. My job as a certified senior advisor, I see some horrific things of people who have not taken care of themselves. So Kyle, again, people want to go to your CURV, KURV, O2. That's for oxygen, right?
Correct.
And .com, and they want to call you, and that number again is you're giving out
972-488-4994.
So if somebody calls me from Minneapolis, Minnesota, and says, Dr. Kyle, I'm in Minneapolis. You can't help me here, but is there somebody in Minneapolis that you might be able to help them? And you can help.
That's correct.
Them
Yeah,
find
I can. I'll put on my link in the page just to make it simple. Different links of other providers like this. Because there's only two different kinds of techniques and programs, that are being challenged. And I have been around this for some time, so I know quite a few in the area. So I would any referral that I have, I always like to make sure. So I routinely meet, with other doctors that are like me around the area. And like I said, a lot of us are also prior military. There's quite a few that are prior military that are involved because it just clicks.
You're bringing up a point, and we brought up an earlier point that a lot of the things that are focused on and happen to us in the military also happen in the civilian world.
That's right.
Correct.
And I know a lot of civilians who can't walk very well. I see it all the time. It's really tragic when you see somebody that isn't that old as compared to many of us that are Vietnam. They're really having a hard time. So find out, learn, grow. Now, all three of us served in the military. All three of us have had some sort of issue. But what would you say, Kyle, to a young man or woman about, hey, why don't you take a look at the military? What would you say to them, Kyle?
Well, honestly, I'd tell them to go Air Force first, to be honest.
Oops.
But, out of all those, military, is by far, some of the more challenging experiences I've ever had in my life. But working with, working towards a common goal, where you have others that you're doing hard things that are challenging that potentially put yourself in harm's way, is something that you're not going to really see unless you're a first responder or, a police officer to be able to see. So it's something that, it's one of the most impactful things that's happened in my life, that sort of shaped me to where I'm at also, from the experiences and the questions and the desire to help fellow brothers and sisters that are doing these areas. So it's nothing that, and serving your country and doing those is by far, as I was saying, is the most rewarding experience that I've felt, is being part of that bigger part, and to, of course, to have others in a bigger, network, as you will, because anyone that's served knows, they all have different levels of experience and different, but it's a cohesion, it's the largest, cohesion. We just need more that are out there like ourselves, that are out there trying to help them, because unfortunately, a lot of stuff that we go through in life isn't necessarily going to be, there's going to be mental injuries and physical injuries, just know where to go, where those are.
Cedric, you and I have talked to young people. What do you say?
I'd say it's the best thing that ever happened to me. The military was, especially for those who have no true direction, not sure as to where they want to go. It's better now than it was so many decades ago when I went through. But there are so many opportunities out there, and the things that people can do today versus what they could do years ago, opportunities are just out of this world. I'd say go for it.
Absolutely, and I do it all the time. I do a lot of work with Sea Cadets. You can see that we're an instructor with Sea Cadets. That's why I wear the shirt, to tell people that are children. Cedric,
and to add,
would you close,
one more
please?
thing.
Because we've got to go. So Cedric, close with a prayer.
Well, Doc, thank you for joining us. And we're just going to pray out. Father God, in your name, we thank you for people like Dr. Cowell. We thank you for people who reach outside of the norm to help those who are in need and who are in pain. So, Father, continue to help us to provide help, hope, and healing to the military, to veterans, to families who need it. And, Father, make this country one nation under God, indivisible, with liberty and justice for all. In Jesus' name we pray. Amen.
And let's all quit fighting and work together.
Yes.
Be together, work together, listen. You may not like what they say, but listen. We're here for you. This is Veterans Impact Show. Please join and share this. Share this to your VSO. Share it to your friends. Share it to those who need it. We'll be back next week.